Going so well.
Give me 2 seconds.
You bet, Tom. No rush.
Okie dokie, we're all set.
Okay. Good afternoon, everyone. It's 2 p.m. and I will call the Larimer Regional Opioid Abatement Council call to order. It is August 27th. Our meeting, we do have several folks virtual today, but let's do our call to order roll call. So first, Estes Park, are you here?
Here.
Good afternoon, Mayor. Loveland, the city of Loveland is not here today, so he did indicate he will be absent, so he is excused. The city of Fort Collins.
Jacob Castillo is present.
Hello, Jacob, and welcome. Great to have you. Town of Wellington.
Here.
I am Mayor Pro Tem Mason. Nice to have you. Larimer County.
Here, Mr. Chair, Larimer County Commissioner Jody Shag-McNally.
Hey, Commissioner, good afternoon. And I, Tom Gonzalez, representing the Larimer County Board of Health, is here as well. So we do have a forum and can proceed. Before we go to public comment, I'd like to introduce Ty Jentz, who is our new advisory member. So Ty, welcome. We're glad to have you. And
Thank you.
tell us a little bit about yourself, if you don't mind.
I'm 42 years old. I started using it at the age of 14, so I have about 28 years of lived experience. I've been in and out of jails, prisons, institutions, halfway houses. I ran halfway houses. I've dealt a lot with the Abundance Foundation. I actually just got my peer coaching certificate, and I'm going for my qualified behavioral health assistant certificate next. So I just look forward to maybe voicing my opinion, maybe helping other addicts and succeed.
Well, Ty, we are very excited to have you and appreciate you taking the time to come and share this experience, because ultimately our goal here is to provide the consortium and wherever gap filling is in our community, make sure all the way from prevention to treatment to recovery. So yes, your voice, your feedback is very valuable. So anytime I don't see you, throw something at me and I'll make sure to call on you, because we want to hear from you.
I appreciate that.
And only 43 and on such a good track here. Plenty of time. That's lots of good.
That's right. Thank you very much.
You have a hand raised in the chat.
Yes, Commissioner.
Thanks, Mr. Chair. I wanted to welcome Ty, interview Ty. And Ty, I'm sorry I'm not there in person. I'm actually on my way up to Rocky National Park. It's been kind of a, I've had a lot of wildlife encounters on my property today, and so I'm still dealing with carnage. So anyway, I just wanted to just welcome you and say thanks for joining us. We really value your experience and your voice. And I'm sorry I'm not there in person. I plan to be, but I just logistically couldn't be there. And I also wanted to note, Mr. Chair, because I don't think we got this on the agenda, but I had been given a couple more names, and I know we only have one person, but we did have a couple other folks wanted to, we had several people before of lived experience on our council, and we had a couple more names come forward, and I wanted to ask the council if they would consider that I could go ahead and contact those people and see if they'd be willing to join as well, to join Ty. So we have all their voices. And again, Ty, welcome. We're so really thrilled to have you with us. And I'm hoping the council might consider us allowing me to kind of interview and do the rest of those as well. Thank you.
Well, Commissioner, appreciate that. We do have that on agenda item 7, if that's okay.
No, I forgot about that. Thank you. I just want to make sure, because we do have those other names. So thank you.
You're welcome. All right, any other hands up? Okay, well, again, welcome. Next on our agenda is public comment. Is there anybody would like to make a public comment to the council? Seeing none, we will close public comment and move to item 3, which is approval of the July 23rd, 2026 meeting minutes.
I'll move to approve the July 23rd, 2026 meeting minutes.
I have a motion. Do I have a second?
Second.
We have a motion and a second. Any further conversation regarding the July 23rd meeting minutes? Hearing none, we'll take that to vote. Does anybody oppose that motion? Hearing none, that motion passes unanimously. Moving to item number 4, Jared, would you mind helping us with that? This is direction regarding available 2026 funds. You'll see Jared's got the nice spreadsheet filled out, and I say Jared and team, great staff working on this. But Jared, if we can scroll down just a little bit, Tom, sorry, it's there. That's the number we need. Jared, can you get us to those updated funds available, the 628,000 and change?
Yep.
On how we got there?
So similar, not many changes from last time. La Familia's application is reflected here, Evix's application, the revised Emmy House Foundation. Those are all in this total budgeted number here. That's the excess that is remaining after that, and then the return capital from Harvest Farm. And and then the total 628 right there. So those are the available funds at this moment.
Any questions with that?
With the current applications being around a little bit over 300,000, does that mean if you took those out, you'd have a little over 300,000?
Closer to 900, yeah, around 920,000.
So the question that we need to answer for Janelle and her work with the Colorado Opioid Abatement Council is that $628,000. If we were wanting to use it for this year, it would be very difficult. We could do that, but it would be challenging. A more streamlined, practical, and timing would be to roll that into next year. We have heard from the council, Colorado Council, that next year, if you scroll back up, Tom, you don't see how we had 3 million this year? Next year for 2027, it will only be 1.8 million. If you all recall, when we first put all this together, David Arrow with the county attorney said much of this was front loaded in the first 3 or 4 years of the 15-year span of this. So we will start seeing that slowly kind of come off as when 2028 is projected to be 1.4. So every year we will start seeing a decline in the total amount coming. So if we can scroll back down again, sorry, Tom, it's just not all fit up. At 628,000, if you roll that into next year, that would be plus 1.8, would still be less than the 3 million. So there, we won't have the same amount of money. But that's what we need to get to Janelle so she can let the Colorado Opioid Abatement Council know.
And you're allowed to do that rollover with.
Mr. Chair, if I might.
Hold on, Commissioner, once I'll get right to you. We'll answer this question. I'll get right to you.
Especially since it was kind of a extenuating circumstance, that money was returned and so it would be hard for us to spend it within a year. They understand that. So.
Commissioner, your question, please.
Yeah, I wanted to add that. Thanks, Janelle. But also I was at the last opioid abatement for the state learning forum, and they told us that we knew about these changes, and also that they said that any rollover funds would have to be rolled over to the next year, and we would have to use those before we could even try to draw down the full farm amount for the next year. So I wanted to say, knowing that even with that roll forward and knowing we're going to get less, and it's still less than we have, I think that this would at least give us that transition year to start to see the decrease in how much money that we will be receiving. So I think that gives us, maybe this all worked out for the best, to give us a little bit of a runway for the changes. And so, and I think that knowing that it would be so hard to try to figure out the appropriate and best use of that money at this end of the year, that I would like to make that motion, Mr. Chair, that we go ahead and roll that $628,085 forward to next year to combine with the lower amount of the 1.8, and let them know that's what we plan to do for next year, since it sounds like we're going to be asked to do that anyway. Thank you. That's my motion.
I have a motion. Is there a second?
I would second that.
This motion second. Any further conversation regarding the motion at hand? I just want to double check the others online because I only see one square. Just want to make sure everybody's feeling like they're part of the team.
It's a lively square.
It's a lovely square.
No other hands in the chat.
So I'm going to check in with Jacob and Brian, you're able to hear everything? You're involved, feel like you're being able to provide input?
Yep, you bet, Chair. I'm all good with that. Yep.
Same here, Mr. Chairman.
Thank you. Okay, no further conversation. Does anybody oppose that motion of carrying over the $628,085 to next year? Nobody hearing that? That passes unanimous. Is that what you needed to know? Wonderful, great. Okay, moving along to item 5. Grant administration, we do have 2 funding proposals. These are reapplications. And for 2026-27, they're a little later in the year, but it's all about timing, right? So first is EBIX. We'll have EBIX come up and give us their proposal.
All right, can you hear me here?
We can, yes. Hi.
Perfect. Hi, my name is Cassie. I'm the program manager here at EVIX, and I just want to say thank you so much for the opportunity for us to present with EVIX, the request of 2026 and 2027 ROC funding cycle. EVIX is requesting $27,071.45 for the 2026-2027 ROC renewal. This funding is under Section B6, Peer Recovery Centers and Events. Our focus for the year is sustain, engage, and connect. The goal is to provide bilingual, community-based peer recovery support that is accessible and closer to home for Larimer County residents, particularly here in the communities like Estes Park. Next slide, please. During the 2025-2026 cycle, we focus on building the foundation for this program. We've launched peer support services for English and Spanish access, created low barrier approach, and established EVIX as a rural access point. Our trained peer support specialists provide trusted, culturally responsive support. This includes individual support, recurring peer recovery groups, navigation, outreach, and recovery-focused education. This year, we're moving from building that infrastructure to consistent delivery, engagements, and measurable outcomes. We have helped 25 individuals so far. Next slide, please. All right. This year, ROC funding will support 4 main areas. Engage people through free bilingual peer support. Support individuals through one-on-one services and recurring peer groups. Navigate by helping identify needs and reduce barriers. Connect people with treatment, recovery, and community services. Our target is to engage at least 40 unduplicate Larimer County residents in peer support services. Next slide, please. We want to be able to show that the program is actually making a difference. We'll track the number of unduplicate participants, individual and group peer support encounters, referrals, connections to resources, engagements, and retention and participant feedback. We're also specifically addressing barriers such as transportation, geographic isolation, limited local recovery resources, language and cultural barriers, SAMA, and fragmented systems of care. And importantly, all of these services are free. Next slide, please. This is a breakdown of the $27,071.45 that we are requesting here. Ultimately, this funding allows EVIX to sustain a trusted bilingual recovery support pathway for rural Larimer County residents. Next slide, please. I'm going to go ahead and pass this along to my coworker, Juliet. She is our family advocate, and she works closely with a peer support specialist. Juliet?
Hola, buenas tardes a todos.
First, do we have our interpreter here?
Sam is on the line.
Sam is on the line. Okay. All right.
Yes, hello, this
Is it
is
okay for
Sam.
her to go? Okay, there he is.
We
Okay.
we
All right.
will do consecutive interpretation. Si puede hablar y luego pasar para que se le interprete el inglés, por favor.
Hola, buenas tardes a todos.
Hello, good afternoon to all.
Como ya lo mencionó casi anteriormente, mi nombre es Juliet Parra.
As it was mentioned before, my name is Bibi
Juliet Parra,
Juliet Para. Sorry.
defensora de familia NIVE.
I can't quite hear. ¿No tiene micrófono?
Sí, ¿ahí me escuchan bien?
Se oye un poco tenue. Quizás hablar un poquito más fuerte.
Ok, ok. Hoy quiero compartir brevemente el impacto que peer support ha generado en nuestra comunidad.
Sam, are you able to hear me clearly? Maybe she can come and use my microphone.
I can hear you clearly. Maybe
Okay.
because she's not at the microphone, I can't
Okay.
quite hear her.
We'll get it taken care of. 1 second.
Okay.
Sorry for the delay, everyone.
No worries at all, no worries.
Hola, ¿me oyen?
Sí.
Ok. Bueno, buenas tardes a todos. Como ya lo mencionó casi anteriormente, mi nombre es Juliet Parra, defensora de familia de NIVIX.
My name is Julia Para. I am an advocate for children and families.
Hoy quiero compartir brevemente el impacto que peer support ha generado en nuestra comunidad.
Today, I want to share a little bit about the impact that has affected our community.
Y cómo hemos trabajado mano a mano con las familias para promover la prevención,
Because we have worked hand in hand with the families to work towards prevention,
la recuperación y una salud mental más saludable.
recuperation, and mental health as well.
En la imagen que están viendo,
In the picture that you are seeing now,
pueden observar a nuestros 3 peer support.
you can see our three images.
Y un poco de lo que hacen dentro de este maravilloso programa.
What is done within this wonderful program?
Ellos son Marta Villalobos, Andrea Rojas y Jefferson Hernández.
Martha Villalobos,
Andrea Rojas y Jefferson Hernández.
yes, Andrea Rojas and Jefferson Hernandez.
Una parte importante de nuestro trabajo
An important part of our job
son las charlas educativas sobre salud mental y prevención del consumo de opioides.
is to have healthy conversations about the consumption of opioids.
Durante nuestras reuniones ofrecemos café, agua y bocadillos.
During our meetings, we offer coffee and some snacks.
Porque queremos crear un espacio cómodo, acogedor, donde las personas se sientan seguras de conversar.
Because we want to create a space where people feel safe to talk about the issue.
Hay una experiencia que quiero compartir donde demuestra el impacto de estas conversaciones.
There is an experience that I want to share that demonstrates the impact of these conversations.
Una mujer de nuestra comunidad que había sido operada de cáncer de mama
There was a woman within our group that had recently been operated from breast cancer.
recibió codeína para controlar el dolor.
And of course, she had been prescribed codeine to control her pain.
Durante una de nuestras charlas,
And during one of our conversations,
ella se dio cuenta que estaba comenzando a acostumbrarse a este medicamento.
she realized that she was beginning to get accustomed to this medication.
Nos explicó que ya no solo lo utilizaba para el dolor, sino para ansiedad o dificultad para dormir.
She told us that not only was she consuming just for pain, but also for anxiety or even just to sleep.
Porque había comenzado a asociarla con una sensación de calma.
Because she began to associate the medicine with a feeling of calmness.
Esto fue significativo y nos permitió reconocer una señal de alerta en su propia vida.
We were able to flag we were able to flag this as a warning for something in her life.
Y es ese precisamente el impacto que queremos generar en peer support.
And this is the exact type of income we want to generate in this type of peer support.
Pero también entendemos que la salud mental
We also understand that mental health
no solamente se fortalece hablando sobre los problemas,
is strengthened by talking about the problem.
también necesitamos crear espacios de conexión, recreación y pertenencia.
Or not only is it addressed by talking about the problem, but also by creating a space where we can offer some recreation and some fellowship.
Por eso desarrollamos un torneo comunitario de fútbol
And that's why we developed the football or soccer tournament
que actualmente cuenta con más de 100 participantes.
that currently has about 100 participants.
Los partidos se realizan martes y miércoles de 10 de la noche a 12:30 am.
The games take place 10 de la noche.
Sí, 10 p.m. a 12:30 am.
The games take place at night, starting at 10 p.m. up until 12:30 after midnight.
Este horario responde a la realidad de nuestra comunidad.
Because this schedule corresponds to the reality of our community, of our reality.
Ya que muchas personas tienen jornadas laborales largas y este es el momento en que pueden participar.
Because many of the participants have long work hours, and these are the only hours where they can participate.
Lo más bonito ha sido ver que no solamente participan hombres,
The wonderful thing is that we've seen is not only have men been able to participate,
tenemos mujeres, niños y familias completas formando parte de esta actividad.
we have women, children, and complete families taking part in this activity.
Esto nos demuestra que nuestra comunidad necesita estos espacios.
This is simply showing us that our community needs these spaces.
Ha sido emocionante ver la felicidad y la conexión y el sentido de pertenencia que estas actividades generan.
It's been wonderful to see the feeling of belonging that these activities generate.
Y como
Produce.
sabemos que el clima en este parque puede cambiar rápidamente,
As we know, the climate in this place can quickly change.
ya estamos planeando nuestro próximo torneo de voleibol
We are already planning our next tournament. It will be a volleyball tournament
para continuar promoviendo la salud mental y la conexión comunitaria a través del deporte.
so we can continue promoting mental health and community through the activity of sports.
En pocas palabras, peer support significa para nosotros educación,
So in a few short words, what peer support means to us is education,
prevención y conexión.
prevention, and connection.
Estamos trabajando juntos, junto a nuestra comunidad,
We are working together with our community
para crear una comunidad más saludable, conectada y resiliente.
to create a community that is healthier, connected, and resilient.
Muchas gracias a todos por la atención.
Thank you all for your attention.
Thank you very much, and my apologies, I'm gonna have to ask that we wrap this up. We do have quite a few other items on the agenda with time limit. Thank you.
Thank you.
Is that it, Cassie, for your presentations? I want to just double check.
Yes, thank you so much for your time, for listening to.
Oh, wonderful.
Thank you.
Any questions from the council?
Not a question, but a comment. This is one of the very few actually based in Estes, I think, that receives funds, while we receive services from many of the other Larimer County ones. We don't have very many that come directly to Estes.
That's correct.
Yeah, and I have been highly supportive of EVICS and its mission in many different ways. The town board, we support them in different ways relating to the child care aspect.
Yes.
And I'm in support of this.
Wonderful, thank you. Any other comments or questions for Cassie?
I also just wanted to say thank you to Cassie. Muchas gracias to Juliet. Really appreciated the presentation and everything that you're doing in the Estes Valley.
Thank you, Jacob. Appreciate that. Any other?
Mr. Chair, I just want to also echo, I appreciate the works at EVICS. I'm very aware of the work that they do, and I'm really glad that when we think back to how we had tried to find some equity work, and I had asked and said, can we let these folks come participate, and Root Wheeler came and presented. I just want to say I'm really pleased and think this is really a good use of this opioid funds, and I appreciate them sharing the stories. And I think the storytelling is really important because it is also, I think, a generational, Cassie and everyone that presented, it's a generational change. And I think that we're not only impacting those individuals they spoke about, but their families and generations. And I think that's really important to recognize that this is also probably generational work. And I wanted to say I really appreciate them coming. And if you're looking for a motion to approve that, or are we waiting till the very end to do them all at once, Mr. Chair? Curious.
I would entertain a motion.
I'm happy to move to.
I was going to make that motion. You can second it, Mr.
Go
Mayor.
ahead.
I'll make that
Go for it.
motion to approve the request from EVICS that was presented in the packet.
I will second that with the affirmation of what great work they do under Director Root Miller. Very confident that it will be very well used to the community.
We have a motion. Any further conversation? I will add that one piece that was hit on the storytelling, which is so impactful, and I appreciate that story, is this sort of this sense of belonging, and that's part of our community health improvement. Is connecting people and minimizing and reducing isolation, because we know they all go hand in hand with poor health outcomes. So that, to me, for me, I'm an absolute yes vote. So, all right, let's take it to vote. All those in favor indicate by aye.
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 Does anybody oppose this motion? That motion passes unanimously. Thank you, EVICS, for the great work you do. We appreciate that. Great stuff. All right, moving along, the Family Center, La Familia. All right. How are you doing, Gloria?
Good, thank you.
Welcome.
Well, hello, everyone. Thank you so much for having me here again, for all the support that you have provided. So yeah, I'm Gloria with the Family Center La Familia. I'm the executive director, and we're here to present our proposed scope of work. So we are committed to, you can go to the next slide. We're committed to delivering a culturally competent and evidence-informed approach to educate, raise awareness, reduce harm, and foster social connections among Latinx, Hispanic families and youth to address the opioid crisis in Larimer County. So based on the environmental assessment conducted during this cycle, where we identified the top barriers for Latinx Hispanic individuals to access services. So this one-year project of scope will address the following key areas, which is continue providing a culturally responsive peer navigation program, where we also want to strengthen the behavioral health provider network, because this is part of the learnings from that assessment that we conducted last year. And one of the things that we heard from our families is that they're not really fully aware of the services that are available, and there's still a lot of stigma not wanting to connect or make the phone call or approaching the services that can help them. We see a lot of parents that they're very unaware of what's trending in terms of their youth. They hear one thing here, one thing there, and they need to have that information, so they come to us for that education. Because we are a trusted site, and this comes with the data collection and continuous improvement, but we mainly want to strengthen and be a resource for all the grantees when they have a family that does not speak English, but they speak Spanish, or they're just afraid to ask, because that's something that we're learning, and we can be a resource for all those other agencies that are providing clinical services or direct services. So just yesterday, it's funny that I keep coming back here, but we brought a men's group. We had 10 men that connected with Lily. She's the new director, right? So she's been amazing, by the way. And we were sitting here and we conducted an evaluation and focus group, and they learned about the services. So what I'm hearing is that men are more prone to utilize opioids and look for resources. So I think it's really a big step that we're engaging this community that otherwise is really hard to reach. Men are harder to reach than women, but for some reason women come to our center more often. But this group that we brought yesterday, they were very pleased. I still need to look at the outcomes and the feedback that they provided, but they thought that this was very, very helpful because they didn't even know how to get here, and they came and they didn't know that this resource was here, was available for them. You can go to the next slide. So these are the activities that are being proposed. We're going to continue using our social connection spaces that we normally offer at La Familia. We're going to be adding more opportunities for families to come to us on a more informal setting so they can connect with the peers, already trained peers, by the way. And then I really want to strengthen that collaboration, because another thing that we heard is that even though they know who La Familia is, they are not really fully aware of all the services that we provide that can support all their families. So that's something that we want to strengthen. We created a flyer, and we are providing a way to access a full description on how a case manager or a case worker or a coordinator can connect to our staff, and that way we can ensure that the family or the person that is receiving the treatment or whatever they're going through can have that support on a culturally appropriate way. And just a reminder that we serve families that live in the mobile home parks here in Alameda County. We have 42 mobile home parks, and we have a lot of families, that 90% of the families that we serve, they live in the mobile home communities here in Alameda County. And we don't work with all of them, right? Because we don't have capacity, but at least 10 communities are constantly coming to us, and our navigators and specialists, they go to where they are, to provide services and information. So this is just a breakdown of those, about those activities, and continue improving that communication, also between the network and probably resources that we might not be aware of. So, the next one. So how we're going to measure impact: the number of families, youth, and individuals receiving navigation support and referrals, the number of partner meetings, and then we really want to collect provider feedback to see how we can improve that communication. We want to set up a number of at least 2 outreach events or presentations completed where families are present, and they can ask questions and connect to resources. And we're hoping to see that at the end of the cycle, the participants are showing increased awareness of behavioral health resources, harm reduction strategies, and stigma reduction. And then we will provide the final report as we're going to be doing during the cycle. I think there's one last the budget, we're asking for less money than last year because we already trained the peers. And that's the breakdown of how we're planning on spending that, or using that amount of funding. So just to do our work.
Thank you, Gloria. Great
Are
work.
there any questions?
Questions, comments from the council?
I do, after, I think it's been a couple presentations that we've gone through and I've studied the organization a little bit in between and everything as I continue to try and learn all the organizations that Roy supports here in Larimer. And I do feel that you are a tremendous help to the community for the efforts that you provide. So I don't have any questions on the specifics. I just feel I give a vote of confidence to this because I see the good work by studying what you guys do and hearing your explanation.
Other questions? Thank you. Comments? Gloria, I did have one on your, under program evaluation, you have the rate 10,000. Is that to pay staff or is that to an outside firm to come in and do some program evaluation?
We have an external evaluator. We contract with an evaluator that helps us to collect the data from focus groups or design the surveys.
Okay.
Anytime we have a group or we do a class, for example, when we teach about use of opioid or some topic, that is relevant to substance use, like what we did with the health district last year. We like to do a pre and post surveys just to show the impact and if people have actually learned, and prevent how to properly store medication, things like that, depending on the topic. We like to collect that data and then, because that way we don't come with a biased approach and say, hey, you were here to learn something and now you're gonna have to show me that you learned something. So we have her doing all the evaluation for a program.
Wonderful, thanks.
Yeah, no, thank you.
Commissioner.
Thank you, Mr. Chair. Hello, Gloria. Thanks for being here and thanks for all the work you do in the community. As you know, I'm very aware of your facility and the things you do out in the community. I did have the same question that Mr. Chair had, but also, so thank you for answering that. But also I had questions about the $7,500 for the marketing materials and events. I'm wondering about the safe disposal kits and the self-care support. I know you kind of touched on this 300 units and I'm trying to understand, is that all inside just for the building or is this at some of the events when you go out into the community?
Yeah, basically to support their outreach and events. That's something that we would like to coordinate with other agencies and then bring the families so they can connect with the other agencies and organizations. And specifically, we want to capture the youth that they're very hard to reach sometimes. They get bored all the time. They get mad. We've seen it with our support groups. So we want to create something that maybe it's a self-care support package that has some tools for them to feel welcome and included and add the information that is relevant to them. So we want to create those flyers, more information that we can distribute in the mobile home parks. Last time, the health district brought some safety boxes. I think that you can either put a gun there or you can put your medication and keep it safe. So we would like to distribute things so people feel that they have something other than just, somebody standing up and talking about a topic. So we want to give them something and, just to support that, those activities.
So, but there was 7,500 and you talk about self-care support, but then you start talking about the youth and there's also self-care support at the 4,500. So is that a duplication? Because you're asking for both of, it sounds like they're both the same thing in those two different categories. So that would be almost $12,000. So I'm wondering about that because it seems almost like that's a duplication. You're asking twice and they're at two different levels. And so I'm wondering about that. And then also, how would you track the efficacy or how beneficial this is with these kids? Because, they are, if they're 25 or $30 a piece, that's a lot per person, especially if the other one's 150. So I'm just trying to understand those costs because it seems like you've repeated them both and it sounds like they're the same thing. I'm just
It
trying
looks
to
like I can
understand.
review that. I'm happy that you caught that. I should have paid attention, but no, I can totally adjust that. Because the way it's reading, it sounds like it's similar, but it's mainly to support, like when we have families and engaging in outreach activities or events, or even the classes that we can hand those out, but I'm happy to review that.
So, are you changing the wording or changing the amount? I'm trying to
I
understand.
think that I'm gonna need to adjust the amount, so it's not like duplicated, maybe just have one line under that.
Okay, so would that be taking out the 4,500 or?
Yes, more likely, yes.
So would bring it to 130, I don't know, would that be
Yes.
135 or something?
Exactly, yeah,
And
basically.
I'm sorry, not to be picky, but I'm just,
No, that's fine.
we have
That's
to
good.
kind of look and it seemed like it
No.
was duplicating. So I appreciate
no,
it. And I'm not,
thank
again,
you.
just trying to do my job with my hat on as opioid abatement right now, but I
Yeah,
do
no,
understand the
that's-
importance of this. So I just wanted to understand, and if it's a duplication, then maybe we should adjust that. Thank you. And so thank you for that.
No, thank you for catching that.
Yeah, you have 134 million. Yeah, 2/3 of your budget is personnel, and that's really where the magic happens.
Exactly.
What happens
Yeah.
is that interaction.
Yeah, that's true. Anything else?
Yeah, no, I think I have no problems with the personnel because I do know when you get someone really well trained and has those relationships built in the community and builds that trust, that is priceless. And you have to maybe invest in keeping those folks involved and engaged. And I know how important it is in some of those communities to build that trust and have that safety and understanding and be able to deliver this message from a trusted source. I think that's really important to note. So thank you for bringing that up, Mr. Mayor. So I would, if you need a motion, I would make that motion with that adjustment of the $4,500 reduction.
And our wonderful team here, it's $134,919.04.
There you go.
So would you like to add that to your motion there, Commissioner?
Yes, I would, please, Mr. Chair. I make that motion with that adjusted amount. Thank you.
Wonderful.
Yeah, I'll second that motion. Yes, it is good, Commissioner, to question some of the incidentals, so fully support you on that idea, but I'll second.
Wonderful. We got a motion and a second. Any further conversation? All right, hearing none, we'll move forward to vote. All those in favor of the motion and the dollar amount indicate by aye.
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 Chair votes aye. Does anybody oppose? Nobody opposed. That passes unanimously. Thank you for the great work you're doing.
Thank you.
All right, moving on. We've got a new applicant, but this is a continuing from last month where we had some questions with Emma's House Foundation. And we were going to go back and look at their request. They have done that, and here they are. So I'll turn it over to David. And welcome again.
Good afternoon, ladies and gentlemen. We are back. Mr. Chair, how much would you like me to get into the history and all that of Emmy's House Foundation?
You don't have the time.
Cut to the chase. Fantastic.
Thank you, sir.
All right, so this month we are requesting $140,000 and some change, $140,000, 370. 50,000 of that, plus a little bit to cover health insurance and that kind of thing is going to go to myself. 50 of that plus health insurance and whatnot is going to go to Mr. Dave Hinkle, my resident services director. We are also looking for incoming resident scholarships for 15 recipients at $1,400 each. That's going to cover 100% of the first month, 50% of the second month, and 25% of the third month. And we are also looking to have an emergency hardship scholarship for any of our residents who get injured in accidents or are too sick to work for a little while. We are also asking the council to cover 80% of our UAs for the year for a total of $140,370. Any questions?
That was
Good job. You win the efficiency award.
Any comments or questions on this proposal?
Well, thanks for giving it additional thought, bringing it back. And enough said right there. I'll let other comments be made. I see the commissioner has her hand up.
Commissioner, yes.
I know, I'm always having questions. I apologize, but I feel like that's my job. I'm curious, can you please expand and help me understand? You said we're covering 80% of the salaries. Can you please expand on that a little bit, please? I certainly understand and support the residents' things. I'm just trying to understand, because I know you didn't have salaries paid for before. And so I'm just trying to understand the sustainability piece of that and how that looks going forward. Thank you.
Thank you, Commissioner. Actually, last month, I did go back and rewatch the video 3 times, and you did say specifically that you were willing to cover staffing and scholarships. And so we kept the staffing number the exact same as it was. We did reduce the number of scholarships because we're no longer looking at a second location. So we did reduce the number of scholarships down to 15 recipients from, I think the original number was 24. But other than that, the staffing for both myself and Mr. Hinkle was something that was discussed in July that you said you would be willing to approve.
But can you expand on the sustainability going forward if are you always going to be coming back looking to have the majority of your salary supported through this for this fund, or are you looking, how is your sustainability plan going forward since you haven't paid for salaries before?
Absolutely. So with both myself and Mr. Hinkle being full-time, we will be able to put a lot more time into grants and sponsorships from other organizations, and hopefully this will be the only year that we will be coming to the commission for any assistance.
That's helpful. Thank you. Thank you, Mr. Chair.
No, thank you. Great question. You did get a letter from, I believe, a landowner about a property.
Yes, Mr. Chair.
That's the property to be used for the 15 recipients, or is this to expand?
This is going to be for so last month I did say that we had a letter from the landlord. I just wanted to provide that to the council for public record. That is from the same landlord that we are currently with, and if we are able to expand, we'll be expanding with him.
Thank you for the clarification. Thank you for the letter. Any further questions? Commissioner, did you have your hand back up, or was that from?
No, I owe you a donut. That's what we say at Colorado Counties Incorporated. If we leave our hand up, we owe a donut. I owe you a donut, Mr. Chair.
I'm always open for a donut. So.
Jacob does have.
Jacob, yes, sir.
Yeah, thank you. I was raising my hand for a donut. Just kidding.
I will, you better watch out. Probably next meeting I will have donuts.
You'll have to bring donuts.
No, I appreciate this coming back, the efficiency in the presentation. I did have a follow-up question around expansion. I know there was a lot of discussion last time about kind of growing the business model. And if you could just explain kind of where you're at now. You mentioned if you do, what are the triggers for growth, and kind of how are you looking at this? What's your business model for expansion?
Thank you, Mr. Castillo. So we presently have approximately 4 guys on our backlog wait list of people that have talked to us, we've interviewed, we've approved for the house. Unfortunately, we just don't have the space. In terms of expansion, it's not off the table, but without being able to get the funds that we requested last month, and it being this late in the year, we are going to have to wait a while before we are able to get on any grants or anything with any, other companies. A lot of money right now is not being given out. A lot of people have already tapped out their grants and sponsorships for the year, which means that we're already looking at the impact grant and a handful of other grants that I've learned about through some of our other people in the community. But in terms of our actual ability to grow, we're not sure. That's going to really depend on the grants and the sponsorships that we get over the next year. And we may or may not be able to grow in the next year based on that. Unfortunately, even with the amount that we're requesting for staffing, we may be able to open it with our own dollar, but there's still too many moving pieces to be certain.
Sure. Yeah, I understand the complexities around that and appreciate you pursuing other funding opportunities. There was also a question last time around kind of follow-up, and I know you said you were kind of working on some systems for connecting with those who have been through Emmy's house to kind of understand how impactful this is long term. So the efficacy of this over time, and just curious if you've had any additional thoughts on how you might approach that work.
Hinkle?
I'm David Hinkle. I'm the house manager, director of the house. I'm building a system to follow up on guys who are there now and have recently, within the past 6 months, moved on. I have reached out to some of them through my phone that I still have, and half of them you can't get a hold of because they won't answer. But I'm gonna set up a chart to follow these guys. Granted, you're dealing with people, so you get them to follow through, it's not gonna be satisfactory, I don't believe. But there is some that we still can call, so to keep the follow-up up to date, I plan to do that and try to do it with every quarter. To start out with, I'll call them every month because I already do on several of them. But to keep a house record about every quarter. And I wanted to say also that I, as a house manager, have taken on I can say he's a career manager. He's a man that, I'm not gonna say his name, but he is a career manager. He's a professional, and he is going to come into our house, he's already been there, and help teach these guys how to focus on a career. Because that's one big thing that I see, a lot of these guys that come in, they're this way. They don't know which way to go. And by bringing in a career manager can help these guys to focus on jobs and help to maintain their stability for when they're ready to leave in the house. So I'm gonna be focusing more on that. And most of my, I'd say half of my income already goes to the house. That's why I'm broke. We do what we can, and I'm gonna maintain that house one way or the other. I have to do it myself or not. So,
Yeah, thank you, Mr. Hinkle. I appreciate knowing that, and it sounds like you're putting in the systems in place to track progress and impact on individuals, and also making sure that you put folks on the right trajectory to not only resolve any substance use disorder issues, but also move into stable employment. So appreciate some of the thoughtfulness around the program design.
you're welcome.
Commissioner does have time.
Yes, Commissioner.
I just wanted to reiterate, I know the expansion is, I know everyone's sad to hear that, but just to reiterate, and I think the county attorney's still on, assistant county attorney, deputy county attorney, that we could not give 100%, and it's really questionable. I don't think we're allowed to really give a full amount for a down payment on a house and things. So I just want to clarify that there was too many restrictions, and we are not allowed to use the money in those certain ways, but certainly we could use it in these ways with the scholarships and helping with staffing capacity. So I just wanted to kind of make sure folks understood that. Again, just to reiterate that's why the questions were raised, because it is something that we would probably get told that when it gets audited at the state and the national level, that it was not appropriate. So I just wanted to share that. Thank you.
Thank you, Commissioner, for that clarification. Any further questions? Would anybody like to make a motion?
I'll move to approve the request from Emmy's house in the total of $140,370.
Thank you, Jacob. That's a motion. Is there a second?
I will second that motion.
We have a motion, a second. Any further conversation? Hearing none, we'll take that motion to vote. If you're in support of this motion, signal by aye.
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 Chair votes aye. Does anybody oppose the motion? There's no opposition, it passes unanimously. Congratulations. And I, for one, appreciate what you are doing and doing it on your own, trying to build this yourself. Whatever we can do to help support you with the great work you're doing, getting people in recovery, ultimately on that road to a successful life. Hey, welcome. Congratulations. Thank you.
Thank you, Mr. Chair.
Okay. Moving along, we'll welcome back Dr. Nathan Briggs from the CSU Prevention Research Center to give us their final report. So, Nate, welcome back.
Thank you very much. Nice to see everybody. So yeah, year 3 of much appreciated and well used funding, I believe. Let's see here. Well, there we go. Okay, so next slide, please. All right, so this is our year 3 at a glance. The 2 words that best describe year 3 are scale up and reach. So as you see here, in year 3 alone, we reached 1,063 students with some form of evidence-based prevention programming, including near universal reach in Estes Park through some universal evidence-based social emotional learning and positive youth development programming. And then scale up being in the Blues program. In year 3, we really scaled up the implementation of the Blues program. We served 88 students, and remember, these are students that are at elevated rates of risk of depression and anxiety, and which are very highly correlated with substance misuse in high school and beyond. So again, just a great year, and this is all in the face of some pretty strong headwinds facing these school districts, budgetarily and personnel-wise. So want to really thank the people that are out in the field doing the really hard work. We are supporting the implementation of some trainer of trainers. So this will increase the sustainability of these programs once these funds are no longer available. We have a second trainer of trainers that is currently finishing up that process. And I'm going to show you some positive feedback and outcomes of those programs. We also layered on to the Blues program 4 additional programs. So some programming for LGBTQI identifying youth in Hooter School District, an alternative to suspension program in Thompson School District, and then 2 programs, and actually 3 programs in Estes Park, one being 2 social emotional learning programs, and then a family-focused program that started serving both Latinx and Caucasian families in Estes Park. We also continued some professional development. We had school personnel complete 1,184 courses on prevention practice, implementation, fidelity, adaptation, evaluation, and sustainability. And that takes the form of a couple of multi-course e-programs that the teachers, the educators can then turn into professional development and kind of moving up that professional development ladder as well. So that's the year at a glance. I'll get into some details in the next slides. So here's the Blues program. Over the 3 years now, we have served 200 students at elevated risk for anxiety and depression. We see 21% decreases in anxiety, 23% decreases in negative mood, 11% decreases in depression, 17% increases in coping, and 80% participant satisfaction. I will say that about half of the students who enter into the Blues program that would screen at clinical levels of depression at pre-test, at post-test, about half of them are no longer demonstrating clinical levels of depression, at least on the screener that we're using. So some really positive effects, and we're excited to continue scaling this program in year 4. Here's some pre-post. We did some pre-post assessments of some of our professional development modules. Social media use and school connectedness consistently rise up to the top of issues of concern for our school partners. So we created some professional development around how for teachers, how teachers and other school staff can talk to their students about these two issues. And we demonstrated that upon that some significant pre-post changes in knowledge on how to do exactly that. Some really nice effect sizes here. That's the size of the effect, as you would think. So we have some moderate to really large effect sizes in educators' knowledge on how to talk with students about these two really critically important issues. And of course, almost all of them enjoyed the course, and almost all of them would recommend those courses to their peers. These are results from our pilot of the Proud and Empowered program. And so what we see here with Proud and Empowered is that we see some all the changes are in the right direction. They're relatively small changes, but you might expect that in a pilot. First year, as the facilitators are kind of getting their legs underneath them on how to implement the program. We anticipate that in future years that those small effect sizes will turn into larger effect sizes over time. So we see some decreases in anxiety, depression, increases in identity, pride, and sense of belonging. Next slide. So in Thompson School District, this is the alternative to suspension. This is one school piloted it in Thompson School District this year. 8 students got caught with cannabis on campus in that one school in that 1 year. 6 of them took the post-test following the participation in that online course. And we're seeing some really neat results with in answering these questions following the survey. And then we're seeing some really nice results for the second step bullying prevention program in Estes Park. And then the Guiding Good Choices and the Wayfinder, this is another social and emotional learning program. And then this is the family focused program in Estes Park. The surveys that came with the programs they didn't do a really good job of measuring the things that we would want to measure in the context of an opioid settlement funded project. And so we're currently working with that school district on developing better measures to capture the results. But anecdotal evidence says at least that the families that engaged in the Guiding Good Choices program really appreciated the program and said that they got a lot out of it. So I think that's it. Yeah.
Awesome. Comments, questions from the council? Good work.
Thank you.
Is there any hands up? Well, I'll jump in. Dr. Reeves, a couple of things. You know, I'm a big fan of this program. And the reasons are, there's 2 reasons why. One, we meet with the superintendents, the public health team, quarterly, routinely, and they're sharing with them and their staff regarding the success of the programs and the interaction and what it's brought to the school. At first, they admit they thought this was going to be more work for the faculty, but it actually hasn't been. Its opposite. It's actually given them the tools to be able to engage and identify higher risk kiddos and get them the proper resources. Because we know higher kiddos with higher egg scores, this and that, could lead to these more misuse of substance. So that's a big one. 2, great work with Thompson on alternative to suspension program. I am not a fan of suspending kids. However, I understand in schools, you cannot have that they're causing a distraction. So they're caught in it. But if you can come up with an alternative to that, fantastic, because the kids should not get penalized. That's where they should get help, in my opinion. So hats off. I think this is a fantastic prevention program, public health, we're all prevention, working with youth. So we just see it as an extension of all that great work. So thank you for your continued work, because this is just fantastic.
Thank you for the support, and thank you to the school district personnel who are the ones that are really doing the work, and then the team back there. I just get to be the bearer of good news. So really want to shout out my team as well. Yeah.
You're right, it is. And you're flexible and adaptive with all the 3 school districts. quite based on their culture, so I appreciate that. Ty, you had your hand
Yeah,
up.
I completely agree. I mean, prevention is gonna be the biggest spot where we actually see improvement. But I mean, once we get to the point where the misuse is set in and the addiction is set in, it's so hard to get out of that. It's just such a vicious cycle. So I really wish we would have had that back when I was a kid. You know, when I was messing up and I got those school spankings and stuff like that, they could have pulled me aside, you know, maybe, you know, educated me on where I was going instead of just throwing a book at me. So yeah, I think this is a great thing. I'd like to see it more in like the whole school district.
Ty, thank you for that comment. Commissioner?
Just wanted to, echo some of your comments, Mr. Chair, and just, Dr. Riggs, I just think that, the research that you showed at the Regional Opioid Abatement Council or the conference a couple of years ago, and this data and finding the feedback from the teachers that it wasn't as heavy of a lift, or maybe wasn't, that it was something they could get behind and support, and how impactful it is. I just, I think again, back to the generational comment, with kind of this group of kids, and some of the ones that are, we missed kind of, that are in college now, just having, after the pandemic and having social media and some of the things that were happening at that time, to have this to intervention and really getting upstream, which is something that we wanted to do as the first few days of the council, was to save lives and to be proactive and to really change the cycle. And I think this is, I'm really grateful this was brought to us, and that it's still ongoing, and it's just tremendous impact and work that I think we can't even maybe measure how this is impacting folks in a lot of ways, and families as well, because I'm sure the staffing and the youth that are going through this are passing it on. And so I think it's rippling even further than this. And I just want to commend you for just amazing work. I'm really proud that our council supported this work, and this work is making a big impact for our county and for our youth that have had a lot of things thrown at them. So I just want to say, well done. Thank you so much. Just really appreciate you and your staff and the people who work with you. This is something I hope that we can just amplify and continue and help the school districts and other youth and other programs. I just think this is tremendous. Thank you, Mr. Chair. And I'll make that motion for this recommendation, if that would be appropriate, Mr. Chair, for the funding amount that was suggested. Thank you.
It is a final report, correct? Sure. And there is some.
I'll make a motion for the final report.
Perfect. Thank you, Commissioner. One clarification to Dr. Riggs. There is some unspent funds here. And is that amount will come back to the council, or were you able to?
Yes. We would have asked for an extension. However, CSU, the longest they'll keep an account open is 1 month after the close. And so there wasn't enough. That closed before we could ask for an extension.
So, Commissioner, would you a friendly amendment to your motion that unspent funds will be brought back to the council at the amount of $19,279?
I will welcome that friendly amendment, but I have a quick question for Mr. Riggs and to you, Mr. Chair. Are you planning to come back next year for the same kind of ask, or are you coming back for another round of funding? I'm curious about that.
Yes. So we have already proposed a 4th year, and that was accepted, 2 or 3 months ago? Yeah.
That's what I remembered. Would these funds help you expand any of that work that was in that proposal?
Yeah, it would. It would allow us to be able to provide even more support to the school districts. Yeah, especially now that the school district personnel are have a lot of headwinds facing them right now. So yeah.
So, Mr. Chair, I'd like to ask the council to consider that we allowed the $19,279.08 to be added to their proposal that they got approved next year to help with these headwinds that they're facing, because we know the school district, especially Thompson and Poudre, are facing tremendous headwinds right now with just decreasing enrollment, et cetera. And don't know if folks, how they feel about that, but I would like to make my amendment to take that 19,000 and add it to their amount that was previously approved, if we can do that.
Assuming that we need a motion to do that, I'll second.
Brilliant idea, by the way. Now, would that require a contract amendment to that one?
Yeah,
Okay.
channeling John right
Yeah.
Channeling John, thank you for that. John is off, well-deserved vacation.
now. So,
Is the county attorney on? Can I make that? Can I?
Yeah, that's a great idea if David's there as well. Okay. Yes.
I'm here and.
Hi, David.
Hi, I heard a number of people making motions and statements, so if you could catch me up to where you're at.
Okay, this is
Sure.
where I'm at, David. I welcome the Second Amendment, but I amended my amendment after that to say, can we go ahead and approve this final report? And then they had said they were going to just give us back the 19,000. I asked that we could add to the amendment that we will give them the $19,279.08 to add to their already approved 3 months ago grant proposal to help them expand supporting the school district with their work because of the extra headwinds that they're all facing.
So if I understand correctly, it's an amendment to the amendment,
Yes.
and that's fine if you second pass that one, and then you go back to the First Amendment and then pass that one.
Okay, so we need to do this in two ways, in 2 steps.
Correct, because somebody may support the amendment that you're proposing now, but they may not support the entire amendment that you were.
So we need to maybe defeat the first friendly amendment and then just do my third one to make it cleaner.
That would be a route that would not require as many votes on it as well.
Okay. Does that make sense, Mr. Chair? Should
It
we
does.
vote on the first friendly amendment to accept the final report
Okay.
and defeat that so we can have the other amendment I made?
We do have a motion on the floor by the commissioner to accept the final report, a second by the mayor, Estes Park. Any further conversation with just that motion? Hearing none. Anybody oppose that motion? Nobody opposes, that passes unanimously. All right, now, the $19,000 question on the table.
I'll make that motion. I had a motion on the floor after that as friendly to ask that we take that $19,279.08 to add to the amount that was awarded and presented by CSU and Dr. Riggs 3 months ago. Add that to their granted amount to help them expand the capacity to help with the program and sustainability.
For clarification, their year 4 award that they received 3 months ago.
Yes.
Correct. Okay. Got a motion, is there a second?
I'll second.
A motion second, further conversation? No conversation? All those that support that motion signal by aye.
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 Chair votes aye. Does anybody oppose that? Passes unanimously. Brilliant idea, Commissioner. Welcome.
How was that, Mr. Chair and David? I just like to make things interesting.
Well,
Thank you, Commissioner. Thank you, Council.
thank you for your awesome work. We appreciate your work. Okay. Now, moving on to item 6. Now, this is the beginning of conversations. We do this every year. We talk about now year 5 funding priorities discussion. Now, of course, we don't have a whole lot of time today, but we'll start the conversation. But I wanted to cue us up a little bit because next month we have lots of time. We just have but we'll have the Colorado Health network here for an extension deadline, no other obligation. So much of September will be this continued discussion. Also in October, we'll have Janelle's wonderful quarterly financial report, no other business. So we'll spend all of October on this discussion. The big thing is by November 13th, we have to have decisions made or percentages into the funding areas, you know, whether that's treatment, prevention, harm reduction, et cetera, we've done before. For new members, that's just a process where we kind of, it's not etched in stone, it's pencil, where we're going to put so much percentage, we're based upon our conversations. So teeing that up, I look to Dr. Jared Olson, who's done this now a couple of years for us, get the conversation started. And knowing, folks, that we have September and October to continue the conversations, because this is very, very important. This is where we set our priorities for year 5.
Can you go down to the graphs for me? Thank you so much. Perfect, Doctor. Okay, so I wanted to start and open up just to give some context and some level setting, especially introducing folks who are newer to the council, maybe have not participated for as many years. If I'm not mistaken, your first meeting was 2021?
2022.
2022?
Yes.
Okay, all right, 2022. So we can see here 2022 is right after our peak year here. 2021 year is the actual peak year for Colorado, Weld, and Larimer County. Weld is a comparison, not as our area of work particularly. For the rate of drug overdose deaths, it's unintentional or unintentional overdose deaths. And if we go down one more, that same pattern holds for fentanyl. It also holds for all opioids in general as well. So just the decline from there. So you can see here, this rate is less than half in 2025, the most recent year, or the Larimer rate is about 60% lower than it was in 2021. The overall overdose rate is about 50% lower than it was in 2021. So there have been significant changes. I'll just point to this last one down here, the opioid related emergency department visits. That's been pretty consistent here. Similar numbers of the number of overdoses for opioids visits to the ER since really 2021 about. And then the MAT requests. So that means folks who are showing up to the emergency department and are either requesting a continuation, some less often, but sometimes still an initiation of medication assisted treatment in this bottom line. So that's dropping down a little bit too. That, you know, there could be less demand, there could be less need for emergency departments to kind of gap fill because services are more available in the community, better accessibility, less folks who are on a treatment like methadone, things like that. Okay, so that's just kind of the level setting. The conditions have changed. If you look at the top of your Region 2 Larimer ROAC goals, you can see those were approved at the very beginning of 2025. So the discussions for those were happening at the end of 2024. So we're right about 2 years since the council has reviewed and discussed this document. And this is what they came up with here. This was also an evolution of the initial priorities that the council had developed and created. I'll pause right there, and I see a hand. We can have a...
Yes, Commissioner.
I'm curious, Dr. Olson, and I'm sorry, can you go back a graph?
Sure.
Two? When we talk, yeah, thank you. The 2025 number, and then I see that creeped up, I would say significantly, and then the graph before this has that spike back up with, this is emergency room visits, but also we see the graph that was before this was the spike also from 2024.
Okay.
I'm curious, maybe this is the billion-dollar question. Is that, do we have any understanding of the uptick? Because that's even more than any year that we've been tracking this. Is it because we're getting, so my question is maybe twofold. Is this because we're tracking better and have more information? Or is this really showing there was an increase in emergency room visits related to opioids? And the other graph before, we had the spike in the deaths. Is it because we're tracking those two at their corners? I'm just wondering if there's more reasons than just more deaths. That, yeah, sure. That one. So,
okay, so
do we have any ideas about that? I'm just curious.
Yeah. I can tell you that the actual numbers here, so these are all presented in rates, just so we can compare across different populations and across different years, right? Because our population increases and change too. But this number here in 2024 is 14 deaths where fentanyl was present, and this number here is 17. So those are very small numbers overall, right? Similar to the suicide data. And so that kind of variation year to year is very hard to say. That indicates some sort of particular change. I would say the overall trend is pretty significant. You can also see Weld continues to go down. So northern Colorado as a whole, probably a little bit more stable. Maybe we're not having the same continued decline, but I wouldn't feel confident in saying there's an uptrend yet. We'll see in the next subsequent years.
And then to the other part of the question is the reporting, or maybe the reporting in the emergency rooms, is more people are, is there a change in any tracking or data collection that also might be contributing to these number changes? I'm just curious about that.
Yeah.
Is that even something that you're able to pull out or distinguish from the
There's
emergency
nothing
rooms?
obvious that would suggest that there's a change in tracking. We have had some changes, you can say, in our overall healthcare system. With Banner kind of reducing their presence in some of the emergency department services that they provide in the Fort Collins area. But as far as how folks are writing up triage notes and coding cases coming in, there's no indication that there's been any change to that in 2025. I mean, one of the possible interpretations of this is, again, relatively small numbers. We've had a pretty stable population of folks coming into the emergency department. You could also argue that maybe some of these folks who are on this purple bar here, had we not had the amount of overdose reversal medications available in the community, those numbers could have been counted in the above graph in those deaths, right? So it is a total picture to get a sense of, and I would say the overall takeaway message is the environment we're inhabiting right now in 2021 is considerably different, in 2026 is considerably different from the environment we saw in 2021, right? We had less MAT availability. We had fewer organizations supporting MAT. We had fewer resources in our community. You all have spent, now 4+ years pushing resources kind of across that continuum of care. And now we are in a different place. And I think it's appropriate to have a reevaluation of what the council's priorities are moving forward, especially in a reduced funding environment, right? About a 6% across the board cut for funding last year, and at least that was the initial budgeting, and we had changes with returns of some funds or non-renewals and things like that. But then we're going to see maybe, at least tentatively, probably closer to a 20% cut if we were to engage in something across the board and everyone came back who is currently funded.
Or that we would need to maybe consider some categories not
That's
funding
exactly
at
right.
all. So, no, I appreciate that. I just needed to maybe, because this is kind of the foundation or baseline to think of, because I agree with you, if we hadn't got tens of thousands, I mean, it's been almost 20,000 kits, I think, over the last few years, we hadn't got some of those kits out. That number, it might be, these numbers here might have ended up being the deaths. So I appreciate that comment. And I agree with you wholeheartedly that, some of I think it's still a lot of the same goals, but maybe we need to think about priorities. So thank you. I appreciate, I'm so thankful for you. We are so fortunate to have you in Larimer County and to have your expertise for this council. Thank you.
I did also have a few conversations in the prior month looking to see if there was something that was a current gap, an emergency situation, something that had arisen that wasn't a major need not being met. Nobody was able to say, this is a major concern I have. If the council recalls, when we had excess money in a prior year, you all, and we'll get to this in a minute, but you all allocated funding to some other priority areas like a focus on equity. And then, did you?
I'm not sure if this is right, but it also might be the purple bar might also be the education of the fentanyl in our addiction.
Absolutely.
Us seeing it and being more readily available and more willing to help each other out.
Yep.
I think that's a big thing, is that we see it now and we realize what's going on. And we're able to help those other addicts as they're suffering an overdose. So that might be another thing.
Yeah, and I think, your insights, the insights of other folks who are seeing it from different lenses than what I can see individually or the public health department are super helpful for this. because we're all just kind of seeing a different, blindly touching the elephant and trying to figure out what its actual shape is. So that's super helpful. Please always feel free to share and please bring those insights as well. Yeah, the drug supply has changed, use patterns and how folks are using drugs has changed and substances have changed. So those are all pieces of it. Okay, so I will just refer folks here to the first 4 goals that the council had previously endorsed. These you can see kind of as our grantees are speaking to their programs and their successes in their programs, you can kind of see these elements in there, right? So the first one is to save lives. That was used through harm reduction means, through overdose reversal, overdose prevention, and doing that. So first and foremost, ensuring that individuals, we saved as many lives as possible, right? That was the goal. Then the second one was to increase access to opioid disorder and to a lesser extent substance use disorder treatment and recovery, knowing that those are intertwined and many folks are polysubstance users. And then sustaining that treatment and recovery. So that covers a broad range of maybe housing, whole person activities, anything that provides that resiliency to that recovery effort for an individual, ongoing access, MAT, evidence-based practices like that. And then finally, the prevention priority, which was preventing SUD among youth and reducing those risk factors in the lifespan, right? So we know that at first childhood experiences, some co-occurring disorders, early initiation of substances, some of those things are risk factors. If those can be prevented, especially among youth, then that reduces the overall risk of OUD, as well as the opportunities such as Dr. Riggs' program in strengthening those resilience and protective factors. So those were the 4 goals. Is there any questions or comments about that from council? All right, then I'll walk you quickly through the principles that were endorsed by the council too, and then I know we're running out of time, but we'll have time, right? Yeah, 3:30. Yep. So we'll have time in the next session. So maybe you all can digest this and potentially, actually, I'm going to pause on the principles. Do you want to end at 3:30?
Yeah.
Okay. So I'm going to pause on the principles. You all can read through this. Just quickly, these were the principles of how are we going to implement this. We're going to implement it with equity. We're going to focus on those evidence-based priorities. Holistic or person-centered approaches, right? Not just treating the disease, but treating and supporting the whole person. Wanting those programs to be sustainable, comprehensive solutions with community involvement, also ensuring that they were both sustainable and that the practices of the council were transparent and accountable. So just quickly on that. Now, with all of that, which was a lot to digest, any takeaways, because I'm assuming we will revisit this in the next month? Yep. Any takeaways or to-dos for staff to support you all, reading lists, best practices, anything that we can do to do that, maybe an assessment of existing programs and where they fall in there, we could definitely do that.
Any direction for staff in preparation for next month's?
Yeah, Mr. Chair, I'd just like to say, I think any gap analysis, if possible, as long as it's not too extensive, I think, a landscape evaluation of what we have to kind of avoid duplication and maybe just work on how we could amplify really best practices. I think any reading or any things you think would be the latest research on best practices, because the landscape, as you just stated, has changed tremendously. And so I think that's a great note. And what we had before maybe is not as what we were trying to do before. You've obviously contributed successfully to. So what would be a system or generational or more even deeper impact? So best practices. That's all the above, I guess.
Thank you, Commissioner. Any others? I do appreciate
I'd like, thank you, Mr. Chairman. Thank you, Dr. Olson. I'm curious about the things that maybe aren't being borne out in the kind of longitudinal data right now. So are there any fast moving trends or issues that we need to be aware of that we could get in front of now that may not be fully borne out in some of the long-term data? So that's more of, I'm looking for an expert kind of opinion of what is happening, because this feels like it's evolving so rapidly. Is there anything we need to get ahead of right now or be aware of, because it seems like this is evolving very quickly? Not to answer now, but maybe some food for thought as we consider this next month.
Great, Jacob. Thank you for that. That's great. Always. That's awesome. Definitely want to try to get ahead of those things, right? Instead of reactive. Any other? Is not see reminders, September and October will be those meetings. We will spend a lot of time on this because we do have priority. We do have a deadline date of November 13th. So we'll get that work going. Reminder, we don't have a meeting in November. I'm jumping to December for the council's consideration. Heather Gilmore, a wonderful executive here, assistant, said, Tom, look at December. We do have a lot of commitments in December. We have 7 6-month reports and one extension deadline. What I'd love to do for December, we've done this the last 2-3 years, extend that meeting by half an hour and go for 2 hours in December. But I would like to get a motion and approval from the council to consider that so that we can update calendars that meeting will be for 2 hours. I move to extend the December meeting to 2 hours.
I'll second that.
Motion second, any further conversation? Hearing none, I will take that to vote. Does anybody oppose that going to 2 hours in December? Hearing none, that passes unanimously. Thank you for that. Commissioner, lived experience technical advisory member update.
We welcome again to Ty. We had gotten an email with about 2 or 3 other names to interview. I just wanted to say I think this is a good suggestion, and we had multiple members before. I just like to have the council's vote and approval to go ahead and interview those people and bring recommendations, brief recommendations for the next meeting.
So there's a recommendation or motion on the floor. I don't think it needs to be a written motion. Anybody oppose that recommendation? I, for one, think it's wonderful to have more voices that we can, the better. Anybody think that's an issue? Which is reality.
And welcome, Ty. Thanks for your first meeting. We're so grateful.
Yes.
Yes, welcome, Ty.
Thank you, guys.
Thank you, Commissioner. It sounds like you've got nods of support to move forward with that. That's great. The more we can get, the better. With that, I'll take a motion.
Thank you. I'll make a motion to adjourn, Mr. Chair. I'll make that motion, Mr. Chair.
I second the motion. Motion second. Anybody not support that motion? That passes unanimously. Great work, everyone. We've got a lot of compliments. Thank you for all your great efforts in this. Good work.
Thanks, everybody.
Thank you. Have fun.